Hey guys, and welcome to How to Gastro. So in today's video, we'll be discussing what is an amylase blood test. So let's get started. So before we get into the specifics of the amylase blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So an amylase blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for an amylase blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood tube is then sent to the laboratory where it is analyzed and resulted. So what is amylase? Amylase is an enzyme that helps to break down starches or complex carbohydrates into simple sugars such as glucose, which the body can essentially use for energy. It is produced primarily in the salivary glands and in the pancreas of the human body. So there are two main types of amylase that can be found in the body, and they are salivary amylase and pancreatic amylase. So the digestion of starch begins in the mouth, where salivary amylase, which is also called ptyalin, breaks down starch into maltose as one chews. This action continues briefly in the stomach until the enzyme is actually inactivated by the stomach acid. We then have the pancreatic amylase that kicks in. So once the partially digested food reaches the small intestine, the pancreatic amylase takes over, further breaking down the remaining starch into maltose and then eventually glucose, which can then be absorbed into the bloodstream to be used by the body as energy. So from this definition of amylase, we understand that it's an enzyme that helps to break down complex sugars into simple sugars, which the body can then use for energy purposes. And there are two main types of amylase, which is salivary amylase, which is produced by the salivary glands, and pancreatic amylase, which is produced by the pancreas in the body. So now that we know what amylase is, let's take a closer look at what the amylase blood test is all about. So an amylase blood test is a diagnostic test used to measure the level of amylase in the blood. So as we mentioned in the previous slide, amylase is an enzyme primarily produced by the pancreas and the salivary glands that help break down carbohydrates into simple sugars. So the test is usually ordered by doctors to diagnose or monitor conditions related to the pancreas or to the salivary glands, including pathological conditions such as pancreatitis, pancreatic pseudocyst, pancreatic cancer, or mumps, which is a viral infection that actually affects the salivary glands in the body, or any other salivary gland infections. So moving on, what is the normal range of amylase in the blood report? So the normal range of amylase in the blood typically falls between 30 to 110 units per liter. So this is actually the normal range of amylase in the blood, 30 to 110 units per liter. So what causes abnormally high amylase levels on a blood report? So abnormally high amylase levels in the blood is a condition known as hyperamylasemia and can indicate several medical conditions, most commonly related to the pancreas or to the salivary glands. So here are the primary causes of high blood amylase levels. So coming in at number 1, we have acute pancreatitis. So this is an acute inflammation of the pancreas, which causes a sudden and significant increase in blood amylase levels. And in this condition, the amylase levels can rise up to 3 to 4 times the normal upper limit. And acute pancreatitis is actually the most common cause of raised amylase levels in the blood report. The second cause is chronic pancreatitis. So chronic pancreatitis can also cause moderately elevated amylase levels, especially during flare-ups. At number 3, we have pancreatic pseudocysts. So these are fluid-filled sacs, which are called pseudocysts, that can develop within the pancreas. often after an episode of acute pancreatitis, and they can also cause elevated amylase levels on the blood report. So continuing with causes for abnormally high levels of amylase in the blood. At number 4, we have pancreatic cancer. So pancreatic tumors can sometimes lead to elevated amylase levels, although this is not as common as in the cases of pancreatitis. At number 5, we have a blocked pancreatic duct. So blockage in the pancreatic duct, possibly due to gallstones, tumors, or scarring, can cause amylase to accumulate in the blood, raising its blood levels. At number 6, we have mumps. So mumps is an infection that primarily affects the salivary glands, leading to their inflammation and also increased amylase levels. At number 7, we have salivary gland disorders. So infections or blockages in the salivary glands, such as sialadenitis, which is the inflammation of the salivary glands, can also cause elevated amylase levels. At number 8, we have macroamylasemia, and this is a condition where amylase binds to a protein in the blood, forming a larger complex that is not easily excreted by the kidneys, and this leads to elevated blood amylase levels, but is generally not associated with serious illness. And finally, at number 9, we have kidney failure. So since amylase is normally excreted by the kidneys in the body, kidney dysfunction can lead to reduced clearance and therefore higher blood levels of the enzyme. So now that we've explored all the causes for abnormally high amylase levels, let's take a closer look at what causes abnormally low levels of amylase on the blood report. So abnormally low levels of amylase in the blood can also be significant, though less common than high levels. So low amylase levels can also indicate certain medical conditions, often related to the pancreas, but also other potential health issues. So here are some key causes of low amylase levels on the blood report. So at number 1, we have chronic pancreatitis. So in chronic pancreatitis, the pancreas becomes more and more scarred and may lose its ability to produce enzymes, including amylase. So over time, this can lead to an abnormally low amylase level. At number 2, we have pancreatic insufficiency. So conditions like cystic fibrosis or advanced chronic pancreatitis can lead to pancreatic insufficiency, where the pancreas does not produce enough enzymes, including amylase, to aid in digestion. At number 3, we have advanced pancreatic cancer. So in advanced stages of pancreatic cancer, the pancreatic tissue may be so damaged that it can no longer produce normal amounts of amylase, leading to abnormally low levels in the blood report. So continuing with causes, at number 4, we have kidney disease. So while kidney disease often leads to elevated amylase levels due to reduced clearance, in some cases it may result in lower blood amylase if the kidney disease is associated with other metabolic changes affecting enzyme levels. At number 5, we have liver disease. So severe liver disease, such as liver cirrhosis, may lead to low amylase levels as the liver function impacts the overall metabolism of enzymes. At number 6, we have cystic fibrosis. So cystic fibrosis often causes thick mucus to block pancreatic ducts, leading to decreased enzyme secretion, including the secretion of amylase. At number 7, we have malnutrition or starvation. So in cases of severe malnutrition or prolonged starvation, the body may reduce its production of digestive enzymes, including amylase. And finally, at number 8, we have the use of certain medications. So certain medications, such as those needed to treat high cholesterol, like statins, may occasionally lead to lower amylase levels as a side effect of the use of this medication. And so the take-home message. So as we have just seen, the amylase blood test is an essential diagnostic tool that helps healthcare providers detect, diagnose, and monitor conditions affecting the pancreas, salivary glands, and the digestive system. Its ability to indicate both acute and chronic issues makes it a cornerstone in managing diseases that impact these organs. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community or anyone you think might find this video beneficial. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can say thank you by buying me a coffee. So the link to buy me a coffee can be found in the description box below. Take care and have an awesome day further. Bye for now.